Hi, everyone. Welcome to QD Clinic. In this QD Clinic, we're going to actually review RheumNow Live 2023. I'm here with the co-host of RheumNow Live, Dr. Artie Kavanaugh. Hey, Artie.
Hey, welcome, everyone.
And we've been co-hosting this show now for about 4 or 5 years. RheumNow Live is a unique meeting. It's unique in that it's shorter lectures, a lot of discussion, a lot of Q&A. And it's what I call vertically oriented education, meaning we do a single topic in a 2-hour block, meaning it's lupus, and discussion of lupus. And then we move on to another topic, etc. And that's kind of what's cool. So in this little preview, I think we want to give you what we think are some of the highlights coming up in this 2023 meeting that's going to be held March 18 and 19 in Dallas, and also virtually at a computer near you. So Artie, my first session that I'm really looking forward to is actually the first session, and it's called Rheumatoid Arthritis, Revolutionary Advances in Therapy. In this session, we have 3 30-minute lectures. Kevin Dean on preclinical RA, to treat or not treat. Dr. Stan Cohen talking about the year of the Jack. And then lastly, Mike Brenner from Harvard talking about the fibroblasts and stromal cells as a new exciting area of therapeutic intervention in RA. These are really cutting edge areas where really I think the practice of rheumatologists and rheumatology is going to change. Preclinical RA, a lot of talk, a lot of studies, but no one knows which drug to use and whether it really is prudent to wait until they get a whole bunch of swollen joints or to intervene at that preclinical stage. The year of the JAK, so many new JAK indications and approvals this year that Stan's going to review. And Mike Brenner's going to talk about the thing we don't talk about, but worry about and are not treating, that's fibroblasts.
Yeah, these are great topics, and I'm really looking forward to it. And I have great speakers. The topics are interesting, aren't they? Because they're not new, but they became new again sort of this year. The early RA with all of the new data, and Kevin Dean is a great person to do that. The JAK inhibs, there's new data with them. And then the idea of the fibroblasts. We've been sort of teasing about that for a long time in RA, and it's be great to see because that might be part of the reason why we still have refractory disease.
Yeah, 15, 20 years, we've been talking about fibroblasts and doing nothing about it. It's worse than the weather. What session are you looking forward to?
Oh, of course, the PSA, near and dear to my heart. And we have a good one, Modern Management of PSA. And Laura Coates, friend and colleague from Oxford, is going to talk about remission. So remission, I think we all know it. But the trouble is defining it. How do you do that in a heterogeneous disease like psoriatic arthritis? And then kind of updates psoriatic arthritis specific. Eric Rudiman in terms of the JAK inhibitors, which are approved in psoriatic arthritis, a lot of new data there. And then Tina Chambers can talk about pregnancy in PSA. A lot of the pregnancy data has come from RA and, of course, from our colleagues in IBD, but there's specific information in PSA, and all rheumatic diseases are just a little bit different with this pregnancy, which is, of course, crucially important.
You know, I got questions for each of these. Laura, I'm going to say, yeah, remission's great. What about sustained remission? What about, getting like as greater response in PSA like they're seeing in psoriasis? What do we have to do to get there, right?
Drug-free remission. I mean, that's the ultimate goal.
Oh, wow, absolutely. And then JAK inhibitors, there's a lot of niche areas here that are being that are evolving with new research. And then I think Tina's going to have to answer the question about pregnancy. Is it like RA in pregnancy, or is it different? And what do we need to do about that?
Yeah. What about your next one, Jack?
Yeah, the next one I think is we got a great session on vasculitis. And it's a hot new area, new drug indications. Rob Spira from Special Surgery in New York is going to talk about new therapies, either approved or being developed for polymyalgia rheumatica and giant cell arteritis. I think that's going to be an eye-opener. Anisha Dua, who's a great educator, instructor from Northwestern, is going to talk about how we assess these patients with GCA and PMR. And then lastly, our go-to in vasculitis, Carol Langford from the Cleveland Clinic, is going to talk about GPA treatment and new treatment choices that we should be aware of.
And looking forward to that particularly. The other speakers are, of course, great, but Carol has been lecturing on vasculitis from the time when we had very few therapies. We had Cytoxan, and that was pretty much it. And lecturing on kind of the pearls that us clinicians love to hear about caring for patients with vasculitis. Now that we have more treatments to choose from, it's going to be even better.
Cool.
So my next one, the next session, rheumatoid arthritis decisive therapy. So we got some cool talks on there. Joel Kramer, best person to tell us about the history of methotrexate and how it's evolved over the past nearly half century. Myths versus reality with Janet Pope from our up north, and talk to us about that. And then Jonathan Kay with biosimilars, which is a topic that was a hot topic 10 years ago. Then sort of didn't pay much attention to it, but it's getting really hot this year. And Jonathan has been keeping an eye on this. So I'm looking forward to see what he has to say on this important topic.
I think these are all kind of hot topics with people shooting from the hip. Rheumatologists love methotrexate, and that's why Joel's the right guy. Janet's provocative from the podium. She's going to ask a million questions of the audience. And then John Kay, I mean, who knows biosimilars better, especially here in 2023 with all new biosimilars hitting the market. We've got a session on lupus that's great. They're going to talk about hydroxychloroquine with Laurent Arnaud from Strasbourg. We have Rich Fury is going to talk about new concepts and new treatments in lupus, and then Ken Kalunian from your institution, UCSD, talking about lupus nephritis and how to approach it. What about the last session, Artie?
Well, yeah, I think that's like the vasculitis section. We've been talking about lupus forever, and we've covered it in conferences. There weren't many treatment options, and now you have choice. That's a really outstanding concept in lupus. And how do you choose? Because like we were saying about PSA, lupus quite heterogeneous person to person, and one person very different from the other. And I think that's what we want our lupology folks to bring to us is how would they approach different domains of disease involvement? And then the final session of the meeting will be on SPA, on axial spondyloarthritis. And we have Atul Deodar, Dennis Padubny, and John Revelle. And that's going to be fascinating. Another area like PSA, where there's been a tremendous development in treatment, and that treatment progress is then turned around and encourage development in how we assess the disease. I think we're going to hear about both of those, treatment and assessing disease, from all three of these great speakers.
Yeah, Dennis has got some great data on new assessments and AI, and John Revelle, sounds like a pretty, boring subject, family history of AS. There's a lot of information on that he's going to really, I think, open a lot of eyes on.
Well, one of our most genetic diseases in rheumatology. We always talk about genetics, but it's most evident in SPA, and ankylosing spondylitis.
Yeah. I want to remind the audience that all of these are just great sessions, but the keynote is going to be given at the end of the day on Saturday by a guy that I went to school with. We were in kindergarten together. We went to high school together. We lived around the corner from each other. His name is Miracle Larry Kelly. And he's one of New York City's first cases of COVID, admitted to the hospital, Mount Sinai, on March 17th, in the ICU, intubated on the 19th, and his story is unbelievable. It is crushingly catastrophic. There's no way he should have lived. And of course, by being at this program and with the label of Miracle Larry, you know the outcome. The question is, what was the journey like? And I tell you, it's emotional, it's visceral, and if you know Larry Kelly, it's going to be very entertaining. So make sure you're in your seats for the keynote.
So I'm definitely looking forward to that. And it says action-packed meeting. So definitely there's still time to join us if you're in the Dallas area or come to the Dallas area. If not, join us virtually. As you can see, it's really going to be an incredible session.
All right, Artie, we'll see you next week at RheumNow Live. Take care.